So, a patient ulcerative may be of a younger age group, is generally rather of a younger age group, and he presents with loose motions and blood, goes down in weight. Colonoscopy, by which an instrument is passed into the large intestine, is the best method of diagnosing a case of ulcerative colitis. A biopsy is taken from the large intestine and a good pathologist would give us the final diagnosis. Treatment in a majority of the patients is comfortable. More than 50% are very comfortable with very routine medication, though they have to take it lifelong. About 20% need higher end drugs. Some of them are expensive and unfortunately not yet produced in India, and that is why they have to pay a high cost, but yet they are available and treatment is on. Another 20% of the people do not respond to any type of medication and would need surgical therapy where the entire large intestine is removed so that the disease is got rid of. The only problem long term with ulcerative colitis is a periodic surveillance is important, and we generally advise once a year checkup, because a small percentage of these patients are prone to develop cancer of the colon. Though the incidence in our country is low, yet it is our practice to advise each and every patient who has colitis, especially one who develops it in the younger age group, to undergo a periodic colonoscopy so that if this disease does develop, it is got rid of at the earliest. So, all in all, an autoimmune disease with good control need a few precautions to be taken, and a surveillance which should keep most of the patients comfortable and happy. Our institute has got, we basically divided it into three groups. One which deals with endoscopy and luminal gastroenterology, where different types of surgery, diagnosis as well as surgery is done through the endoscope, be it the upper GI, the lower GI through a colonoscope, or through for the liver and pancreas. We are especially well known for a rare and a complicated disease called chronic pancreatitis, where we have got machines to blast the stones and then extract them. We have got a very advanced liver unit, wherein patients of early or advanced liver disease are looked into, a special intensive care, because liver disease is associated with many complications where these patients can be attended to. And finally, in our group we have an excellent surgical team which along with us takes care of all the emergencies pertaining to gastroenterology, both in an acute phase as well as cold cases, so that a complete team is available with us. We also have developed an excellent radiology department, wherein we have patients where a radiological intervention suffices to get rid of the problem, like a bleeding from a major blood vessel, or sometimes getting rid or putting an injection into a tumor of the liver, and this is done by our interventional radiology team.